So one of the most common operations done in the United States is removal of the gallbladder or laparoscopic cholecystectomy. Even though here at Advanced Surgical Partners we're known for being experts and having a center of excellence for weight loss surgery, we do other things, and removal of the gallbladder is one of those things. Nowadays, removal of the gallbladder is done laparoscopically. It's an outpatient procedure where you come in, you go to sleep, you have it done, and you go home the same day. Most patients recover within a week and are back at work at light duty. No lifting, anything at all, no pushing, pulling, or lifting for the first 2 weeks after surgery, but then after that, you gradually increase your activities and you're back to full duty by 6 weeks. That doesn't mean you're out of work for 6 weeks. It just means that for the first week, you take it easy. You're back at light duty work, desk type work from week 2 to 4, and then at 4 weeks, you're lifting 40 pounds. At 6 weeks, you're doing whatever you want to do. Gallbladder surgery is another passion of mine. It's a great surgery to do, but it's also very fulfilling in that patients who will have various abdominal complaints, whether it's pain in the mid-abdomen, the right side, the back, bloating, diarrhea, or other symptoms, can be gratefully impacted by just having their gallbladder removed. Again, doing the gallbladder laparoscopically allows for less pain, less discomfort, and quicker recovery. Gallbladder surgery itself only takes about 30 to 45 minutes in a straightforward case. It can take up to an hour or an hour and a half if it's more involved than that. What we recommend is when a patient has gallstones or symptoms of gallbladder disease that you get the gallbladder out at your earliest convenience. What we don't want is the gallbladder deciding when you have the surgery. We want you to decide when you have the surgery. So part of that means staying on a bland diet until you get your surgery and get the gallbladder out. If you don't follow a bland diet and you eat high-fatty foods such as a cheeseburger or pizza or bacon or things like that, you could have an acute attack of gallbladder disease. And if you do, you might end up into the emergency room and you could end up with an infected gallbladder. And if that happens, it lessens the chance that we can take your gallbladder out laparoscopically. In every case, we want to take your gallbladder out laparoscopically rather than the old-fashioned big incision under the ribs. That incision is much more painful, it's a much longer recovery, and that has more complications associated with it than a straightforward laparoscopic surgery. Now, not every patient who has gallbladder disease has gallstones. Having gallstones and diagnosing gallbladder disease is very easy. You get an ultrasound, we find that you have gallstones, you have symptoms that go along with gallbladder disease, and we take your gallbladder out. However, some patients will have symptoms of gallbladder and they get an ultrasound or a CT scan and there are no gallstones and they're like, oh my gosh, am I crazy? What's going on here? Well, there is another way that your gallbladder may not be normal, and that's in that it doesn't function normally. It doesn't contract and empty the bile at a normal rate. Most patients, when their gallbladder empties, it empties at about 60 to 70% of the bile in the gallbladder and empties it into the bowel. Patients who develop a dysfunctional gallbladder, or what's called biliary dyskinesia, have a gallbladder that kind of quivers and doesn't empty. As a result, that gives you the same discomfort and same pain and symptoms as a gallbladder that has gallstones in it. So how do we diagnose that? We get a hida scan. A hida scan is a nuclear medicine scan where you go into the hospital, you have an IV put in, you have a tracer injected into the IV that is taken up by the liver and secreted into the gallbladder. You then have a second medicine that's given to you that allows and causes the gallbladder to contract, and we measure how well the gallbladder contracts. If it contracts at 60 to 70%, your gallbladder is normal. However, if it only contracts 30% or less, your gallbladder is not contracting normally. That's considered an abnormal test and can cause the exact same symptoms as a gallbladder that has gallstones. And in that instance, we recommend taking your gallbladder out and having a laparoscopic cholecystectomy.